Hello, this is Chloe Wilson, and I will be presenting types of animal-assisted interventions. So, an overview. So, when conducting animal-assisted interventions, there are three main categories of the interventions that are used. In each category, the animal's welfare is prioritized by a trained handler that monitors the animal's physical and psychological welfare during animal-assisted interventions. So the categories are broken into implicit, explicit, and instrumental. Why rabbits? So rabbits are great for animal-assisted interventions for so many reasons, and I've listed all of them for you. So starting off with, rabbits enjoy human interaction, which is super important that the animals involved actually enjoy and are consenting to the interventions. Calm demeanor, which is great. Easily socialized, which is very important when working with people. They are lap-sized, which is great for many different reasons. They can sit on a client's lap easily, and they can be transported easily. They are litter trained. They are loving and caring. They have playful tendencies. They are trainable, which is very important, especially for instrumental practices. They are cleanly, and they frequently groom themselves. Interactions with rabbits ease stress, depression, loneliness, and pain levels. Rabbit and human bonds improve confidence, social skills, empathy, boundaries, focus, attention, responsibility, and so much more. And they are low maintenance care. Implicit. So the definition of implicit is this involves a passive and indirect participation that does not require a specific skill set in the animal and rather relies on heavily key attributes. So an example of an implicit interaction would be during an intervention with the therapist, there is a playpen with rabbits inside. The client is close to the rabbits during and can see them in the session. So this is implicit because it is an indirect participation. The client can see the rabbits. It's in the same room, but the rabbit isn't necessarily involved in the intervention in an organized manner. So species used, the breed doesn't necessarily matter in this instance. The rabbit just needs to be qualified for animal-assisted interventions. So vet checks, they need to be friendly, they need to have their nails trimmed and all that good stuff. So more examples of implicit is observing or being in the presence of animals. Animals are a part of the therapeutic goals. Redirect attention outward. Animal contributions are primarily in terms of appearance or natural behaviors. Interventions are often indirect. So moving forward to explicit. So definition includes simple interactions and may indicate a need for more deliberate selection of the animal participant having to do with skills. So an example of this would be a handler works with a therapist and chooses a Flemish giant rabbit to provide comfort and ease anxiety during play therapy. Flemish giant rabbits are extremely docile, social, and love physical attention. So this is extremely important, and this would be explicit because this specific breed of rabbits is used for a specific goal. So other species that would be great for this would be Holland Lops, Mini Rex, Lionheads, Netherland Dwarfs, Dutch rabbits, Polish rabbits, and California white rabbits. These are all rabbits that are calm, friendly, love interaction, so they would all be appropriate for explicit interactions. So more examples of explicit interactions: directed observation or simple contact with animals, animals as passive therapeutic agents, animals serve to enhance rapport, focus, attention outward, enhance assessment, and encourage sensory and cognitive processing. So lastly, we have instrumental. The definition is the animal is actively participating in a highly tactile way and is required to have specific skills and training for this role. So an example would be a trained rabbit and handler assist a patient in a hospital enduring treatments. The rabbit is trained to sit still on the patient and is rewarded with treats after a clicker is used. So this is instrumental because the rabbit is actually trained. The rabbit is trained, the handler is trained. It knows that it is supposed to sit and be calm and just get some attention and get some treats. And so it is trained, the handler is trained, it has a specific duty. So the species needs to be calm, social, and trainable. Rabbits that work best for these interactions and breeds that have those qualities are Flemish Giants, Holland Lops, Mini Rex, Lionheads, Netherland Dwarves, Dutch Rabbits, Polish Rabbits, and California White Rabbits. So they're really the same breeds of rabbits. Maybe there may be a few more, but these are the most popular and used that there's actually articles on. And then more examples of instrumental interactions are directed activities and interventions between animals and clients. Animals are active therapeutic agents. Focus on processing of intervention, skill building, and developing or practicing new behaviors. So, moving forward, these are some of the popular breeds used for therapy purposes, and they have all the amazing qualities that we need when involving rabbits and assisting in animal-assisted intervention and animal-assisted therapy. So first off, we have the Flemish Giant, which they are so docile, so gentle. They're frequently compared to cats and dogs. They're just so amazing. Then we have a Mini Rex. They're adorable, they're easygoing, they're friendly, and they are on the smaller size. So that is can be a very great thing depending on who we're working with, age, and all those things. And then we have a Lionhead. They're so fluffy. They're friendly, playful, social. Lionheads, as I just said, they're very playful. So they will interact in playful interactions and bring lots of happiness to people. Then we have Dutch Rabbits. They are super calm, super easygoing. Then we have Netherland Dwarfs. They are so gentle and affectionate. They will literally just sit on your lap and just sit there and not move. They're so soft, so sweet. Then we have Holland Lops. They are so friendly, energetic, and playful. So we kind of have a mix of a few of the different breeds with the Holland Lops. So moving forward, on to welfare needs and animal-assisted intervention categories. With rabbits specifically involved in animal-assisted interventions and animal-assisted therapy in therapeutic, educational, and hospital settings must have their physical and psychological needs met. In order for safe and beneficial interactions, rabbits' behavior must be evaluated before, during, and after animal-assisted interventions to ensure they are consenting to the interactions. So this is super important if the handler is using an ethogram. It should have all of the rabbit's behaviors from positive to negative and all the stress behaviors. Since stress isn't necessarily positive or negative, the rabbit can be having fun and still be kind of stressed out if it's playing, or the rabbit could be unhappy with an interaction, they could be stressed. So the handler needs to be able to differentiate between when the rabbit needs to be removed, when the rabbit is not in a good place to be brought to an intervention. So that is extremely important for the rabbit's welfare. Rabbits also need to have a safe space provided and set up during animal-assisted interventions for them if they need a break. If they're showing stress signs, they need to have hay, a little bit of pellets, water, and some of their familiar toys where they can express natural behaviors, feel safe, feel a familiar space where they are comfortable in. And then in order to prevent unsafe handling and interactions between the rabbit and the patient, the animal handler should teach and demonstrate correct ways to hold and touch a rabbit. This is super important because rabbits, since they are prey animals, if we're approaching them from the top and they don't see us, that could frighten them. If we're not supporting their legs, they tend to jump and scratch, which we do not want. So they need to be very supported, and they need to feel like they're not about to fall, or they're not leveled or balanced. So I put some pictures of what I just spoke about. So I put a playpen. This is a very simple playpen, and it's actually easier than it looks to set up. The playpen is foldable. You just fold it out, throw a cage liner underneath, and then there's just a few things. There's a litter box, a waterer, and then 2 comfortable and familiar toys. This is very important, and this is a safe space. So moving forward to how to pick up a rabbit, I placed I think this is from ESPA website, and it shows 3 different examples of how to hold a rabbit, which is very important, and these should be demonstrated to whoever wants to hold a rabbit in animal-assisted interventions. And then next to that, I listed the simple categories of rabbit behavior. We have happy rabbit behavior, worried rabbit behavior, and angry and unhappy rabbit behavior. These are only a few. Rabbits have so many behaviors, but these are the most common ones. So if a handler is observing these things, that would be when it would be like, okay, this is great, they're happy, or I need to remove the rabbit, put it in a playpen, bring out a different one during the intervention. So, integrating rabbits into animal-assisted intervention in a humane way. I listed a few methods that can be used. So the first one's the playpen method. This is when we set up a playpen that's big enough for a client and the rabbit or rabbits. It has seating for the client. It has some toys, some fresh treats for the client to feed the rabbit. That serves as a good bonding interaction. And this setup can be indoors or outdoors, and it allows the patients to safely interact with rabbits. This is awesome because sometimes the therapist may want an outdoor setting with some nature, and we can still interact with the rabbits there because the playpen keeps the animal safe, and we can still conduct it outdoors. Rather, if they were free roam, they could get away. Lots of bad things could happen. Then we have the free roam method. This is when the rabbit free roams in the therapy room or wherever the interaction is being taken place, and it sits with the patient wherever they choose. Maybe they're sitting on a couch with the rabbit, maybe they're on the floor, maybe they're in a chair, etc. And this allows the patient to have the rabbit with them and freely interact. It adds more freedom, less boundaries, more variety of where you can interact with the rabbits. Then we have the basket and blanket method. This is when the rabbit is held in a basket. Maybe we have the rabbits in a basket on someone's lap. This can just prevent wrong handling. Maybe the client is a little bit nervous to hold the rabbit, so we just plop a blanket in a basket, put the rabbit in there. Makes a very safe and easy way to interact. Then we have the blanket method, where you basically swaddle the rabbit, and they actually love it. They love it. It makes them feel calm and secure. And the client or patient, they just hold the rabbit swaddled. And this is also a safe interaction, safe way for clients to hold rabbits and prevent jumping and scratching and things like that, especially if it's a younger person holding the rabbits. And then lastly, we have the leash and harness method. This only works for trained rabbits, obviously, and they have to like it. If the rabbit hates it, even with training, it's not good to keep putting it on the rabbit, but with training, they can actually enjoy it. This is when the rabbit will hop around with the patient indoors or outdoors. This is very rewarding. The rabbit will hop around, follow you. It's super cute, and it's also safe. And that is my last slide, and I hope you enjoyed. Thank you so much.